optimization on a phantom structure. So this is one case where you can see that the target is in this region. There's a hotspot far outside the target on that side of the patient. You can add a structure like you see drawn here and just do a re-optimization, including this structure with some dose volume constraints, and end up making a conformal dose distribution. So you can see you can do that without even having any normal tissues in place. And a lot of times you can get just as good a plan as if you're going to add all the normal tissues and find out what the eventual dose is there. Another thing that you can use, and this is something you'll have to work out with your physician, is that you actually break up the target and use that as a tuning structure. So here you have a gross target, and then we have a region that we call CTV60. So around the gross target, we want to make sure we cover part of that region with at least 60 gray. So we put another target there. Here's a side shot of that, and the blue is the CTV60. The red is the target that gets 66 gray. Then we have the regional lymph nodes that are most likely for tumor spread. So these we want to at least get 54 gray at 1 point gray per fraction. And then there's prophylactic irradiation of other lymph nodes where if we only get 50 gray or 52 gray, that's acceptable. But you can see if you break up the target volume in these different regions, it helps you control hotspots and get better coverage eventually. Isocenter placement is another aspect which, where the isocenter is, sometimes can have small effects on your treatment plan. One of these plans, this plan actually has the isocenter located right here in the middle of the head, and this one has it shifted over in the center of the target. And you can see there's same optimization parameters, and just rerunning it based on where the shifted isocenter is, you get a little bit more homogeneous coverage of the target region there as opposed to here. Another issue with isocenter placement is that it's not just about dose